mia na ndi misigo tokwana na siligolirirense sana ekaroro magani kunyara tuli kwa mafundisho ngana kiungana to chake biashara bya mitumba naenda abangi siko gali nkwibuli balenga nimbwate bibesa bikeigo nkinda nyare ko bagingokora wakaribishirwa asema matefi mitumba otini kibesa kiriyo bwate elinde tunyare ko batowikaransa tunyare ko manyanga musigo kyota kere ko bagogo chakera oyoro muya ligoli elili kasi kiriyo bwate igobono kera nyare kana ngano bwate kiri busano elibusita tuikaransa ngari go kubolinga inkina akore
asamange bakire simiase namba 0727081605 gose 0727574835 nigo bakwigora amatukonse sheiki mama tifi mitumba obokoryo bya bwa mitumba origene.
Welcome to Hurricane Academy Kisii, a modern mixed day and boarding school offering CBC curriculum at preschool, primary and junior secondary levels. It provides a serene learning environment, enough qualified teachers, modern facilities such as library, computer and science laboratories, classes and dormitories, playgrounds and accessories, and they nurture talents and excel in sports, and their scholars are picked and dropped home. To secure a chance for your child, visit us at Yatwenya, Kisii Maran Road, 2 kilometers outside Kisii town, or call 0755 331318. Hurricane Academy, the future is here.
Nuga nizikonyore mashini yekerero yogosona chianga gose gosibya Kigali bono Gusi Star Shop naryo lichiburyago nigo bwate machine buna bono pusher mill machines, generators, car wash machines, submersible pumps, gasoline water pumps, compressors, welding machines, lawn mowers and brush cutters, workshop tools and machines buna bono, grinders, drills, circular saws, demolition breakers, batteries amunebi ndewinge nigo babwate qualified staff member bago ko manyigoro ye machine ya oraganie nigo bago tuka Kisii Town Gusi Plaza room number 6 boiko babwatoro sagironde angena family bank asamange bakere simiase namba 0731 224000 gose 0796 477853 Gusi Star Shop, a total one-stop tools station.
Karibu Hurricane Academy Kisii, shule ya kisasa ya bweni na kutwa kwa wavulana na wasichana inayopeana masomo ya CBC kuanzia preschool, primary na junior secondary. Iko na mazingira matulivu, walimu waliohitimu na wa kutosha, maktaba ya kisasa, mahabara ya kompyuta na sayansi, madarasa na mabweni ya kisasa, mahali pa wanafunzi kujifurahisha na pia wanakuza talanta na kutia fora katika michezo mbalimbali. Vile vile wana usafiri wa kutosha. Kupata nafasi ya mwanao, watembelee Yatwenya, kilomita 2 kutoka mji wa Kisii, barabara ya Kisii Marani, au piga simu nambari 0755331318. Hurricane Academy, the future is here.
Ne nobwate ebyasara gusemega uraganie tukubikirira itangazo ebene sukuru eduka inyagitari inyangi gose amatanga vono nabugutwakira esimi ase namba inoti sana ibere isato isano isato 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 inoti kumanya mange mono na buigo na bugu tutarira asensemo ya Nyamataro Itaya House mwensi twabariganirie.
Nebo kwa heri mangeri gocha Keraba chenu baraumira nenkana to
Omwanchwa omorigereri bweta TV samari tangoro kudan Hassan omoteli o country music kurwora gongorwa gusi ko bari gani asema music concert and a special Sabbath worship yera abasa magacha ATC all aria Kisi town chikwaya kurwora gongorwa gusi na isiko nchibororo na abateli babene mbaboro kurwora gongorwa gusi na isiko inyore tariki 17 umutinyo gatano Mei mwensi mwaleganiwe na wakaribisha sana tunapoenda kumshukuru Mungu wakati huo. Karibuni sana.
Tikiraba onye turakeigwa na gokerora imejeta ya TV.
Bunapotambiriane Brighton Makori.
Eliane Diana Kwamboka Gisoi.
Bono kira rituko li Jumatatu.
Nainche Job Ongaga.
Jumanne.
Cheni konkoro kwa Eric Bosir.
Encheriane Evelyn Osero.
Jumatano.
Nche Joseph Mose.
Alhamisi.
Konkoro kwa Eric Maube.
Naboiko Ijumaa.
Cheni konkoro kwa Eric Bosire.
Neikendi ya gobono ni gitabe vuna botambe. Kera rituko li Jumamosi.
Nchinkuru kwa Sara Nyarangi Ontita.
Na soko ekura na koyechaka eike.
Eritriane Evelyn Osero.
Naboiko kurwa setaya Chiko Soli.
Konkoro kwa Kefa Nengo Bosire.
Nigo tuyariganirie koeneke bunura bwobo nkora babole na goika asole. Etaya TV uburabu bwagusi. Eikieye imeje sabaliane.
Ngoroku Zakari, Nduso, Nyamatali.
Nyamatali.
Aina ramba yata maleta na boronge.
Nyamatali ni liye sokoro?
Nyamatali ni tata.
Oho, aino Nyamatali.
Jino Nyamatali. Ono
Dietalilelea sana. Nanya goliwa lakini nina aligulelea.
na boliro, chisokoro jasa itondiro.
Ndiro, that's nice. Yes.
Ona kala enge sukuru. Aba bisaku byariko kumenga byariko ndokanga munyamatali.
Bono gwasomire gwachire mpaka amangana yo bwalimu lakini okorana eriyo konya ukina no bwalimu bwathete ko babori bwathana administration
Nchabono thinki neti ntaketa ko mwalimu enga kiyo na rekorota sana ngambe modisi karona kura ngasoka isiko koligari yegasi kanyora nanyorire ngati tindanyora gasi yana eboronge yana atagete
kanyora gasi ke watagete
gasi na atagete administration boteneneri tinaenyora so nganyora ties sinko likera balimu ekora njena somerte languages so ngaswa ties
Wakumu ya Nebuntu Nebia Etaya TV ni gotoko baenekeria amaya yo mwaka o 2025 wekerengero berishaito wasamangana amaya na onse asugo komanya kogosemia na kokogokia 2025 etaya emurike gusi nese abo no etaya togokuna etaya TV obrabu waguse.
Etaya TV Oborabu Wagusi.
Alright. Mwanjumu Oigara with Etaya TV na indi chigati chiri chaikire. Tawa batinga lichukule Jumatano butambe toshitokwa na magana ngeze chisemi kulinde nje. Uno waziri wa bachenu asomuru gweta breakfast show. Tawa banga no way. Oigara ende tokwa na magana ngete bachenu ekiagara rende no somu ko rualeti. To konyare kwa ende school osonyara kwa kende kere gwete bobe. That is why no yana celebrate data simambia bona to abolianga ine. Ekero moko wana onenchi mitiko kambo. Ekero moko wose nyagitari malio gachire. Ngiko nyona abantu abangi batari ko batayare kwenda nyagitari w'ikikolengwa. Abantu mwato wa so many reasons which ndo kusomera wa nyagitari by the way abantu mbaweta kwenda bakolwe bipimo mbali asichi nyagitari. And for that reason wanchu Oigara there is a medical camp and an mono ekwenda na litikolia angyo. That is why I have experts process mo iyo bachenu bawo sangana intwe asimambia bono igorero to mosoto boto besa kosuka kurase Etaya TV ekiagera abagende baitu muno chabo ase TV yawo igobari mari dadi and tele bagende ba kawaida osuba botambe na bagende babata experience and knowledge esamana lenge to bochenu abange baino ombera nenda baragwo ase health facility kende mboba banyete kende kuarora more wono ase libwa kabisa gochibara introduce Ngekigima toba manyanga marabitole nabarakugega as studio nekiringa kyabale tangega as studio unenchera yamoyo ko give back to the community na botelia abantu barakibamba bagwenda takomenya bya kyabonchenu ekyagala barabuko umiranire n'abantu bakwate hali mbalimbali cyamangana y'emechando y'amarwere. That's why they are here nganto ganya tugenda nyagitari kurende ko nyagitari ya umwire wo cyane nasemore na inumo gwatensemero n'abananchi ngasimambia bono na watu uchikuligere igoro ya mangana yo bochenu. Karibu sana asisema ya online producer ne wantenga na watu Facebook ni watu live right now Etaya TV, YouTube tuko live right now Etaya TV, SMS line twanyigolire kabisa 0735 333-000 tocho kwana igoro yobuja woko nyorobo gwenya igoro yobuja woko genda sichimiti ko kambo ekero chia chire igoro yobuja woko kolerwa screening kumanyikana maroiro kwata sumubere ebito binde binge ndati nkwane mono mwanche mulgereria nganjire asenjere yabene. We introduce our guest as students mabiabono watatai barabumba rabi engere tukene kuchaka omurubule karibu sana engere ta TV oborabu wakusi yaronto kwa ladies ga guest goto kwa the gentlemen and what to take to chinkari basi mabiabono. You don't want to miss a discussion in mabiabono. Yato chakara kwa ne my far left. Karibu sana.
Mbiamono ase amarieta ni ngoro ku Dr. Donald Ratemo Ongechi. Onde mune clinical pharmacist, that is a consultant pharmacist at Kisi Teaching and Referral Hospital. Na inde deputy county pharmacist Kisi County. So lero twataka tukwanira mangi yechi medical camp. These are free medical camps. What we offer, what services will be offered as wananchi na obuya. Wogo chasa chi medical camp echi. Tari rasi mobe no muruire. Ese no ruarete na gokonyana nderi bagali woche na ndurigere ligubya. Biamono.
Karibu sana Daktari Donald. Karibu sana Daktari.
Biamono. Marieta ngoro with Dr. Raymond Oigara. Sito Ongechi. I'm a consultant surgeon, yani consultant samgana yoko bara. And endoscopist yoko gireri ime jinda chiamanto ime korwa sijal sanchiro na bintagete. And Raymond University. Nerete Ogosomia Wanyagitari Kisi University. Yani I'm the Dean of the School of Health Science, Kisi University. Yo co-host medical camp ya Angkyo.
All right. That's a very brief and decent introduction. Once you can agree with me. One of the type of people who are the right people. Dr. Donald, Ratemo, Dr. Raymond Oigara. I think you've met them as Chinse Mokada. Dr. Oigara, what are an endoscopist?
Endoscopist.
What does that even mean?
Endoscopist, Garomo, the weather, Amaruera Yenda.
Yes.
Abantu bakata vendwari yanda. Also koroka maninga. So kwenda maybe aja wata maninga aja nene. Na mondo tako manyagwa so korigere bosaigo so manyagitari so kobata. Weka akumoreke abeke ngandeke ko chimonu. Kaganda bakanda kimoreke kerase.
Wow.
Kimoreke mara onsi kimamene dio tendiro na kioruarete. Na alsa bosaigo. Ne kansa bosaigo chigas bosaigo. Elino to manya. Gama na wana wanda wange bakagorwari kuna alsa na demba gwati alsa. Ono wacho toma moreka twanya waratari alsa. Twanya abandi konya kansa bagwate warwari wichi alsa no ene myaka ebere. Iko na ndi gochimbia kwa boli. Ekero monta kwa warwari wichi alsa. Matukana yani amatuka mangi. Kwa deriko buena enjuwa molekwe kwa endoscopy to nyakota buna ekiti yiteri original gando goro original na lyo buena ukendo ke obneki amarioga na boko buena onya ne chialsa challenge
igoma mondo moyo obikirwa a certain equipment
gochimono iga kwa kali yogo ara iga gosensia obikirwa gochimono egendo ke bwate camera neta ya tuwa morgia so gochimono gochinda tumba toligere TV ga enda bunere ngamo yoko merenda gara amara evon nere ko endoscopy.
Is it very painful?
Very painful. Kwa yoko rara go karatoriga bosonko manoma na rise galaxy storm to ver.
All right.
Evon.
Wow, that's very nice. Dr. Donald, I want to mangana a pharmacy.
Mariogo
ndo kwata kana chiko bataka Mariogo. Ulenje ningalo jenda igumube ndio hata sijamaliza hiyo dose. I felt like I'm okay. Ngatigari mbobe.
Abumbobe kabisa.
All right.
Be straightforward. Kera kwa iru eliogo liria nore gwatebi guna matuko atano kunywa. Onyu ritko litangani onyu ritko lya kabere gukwabere buya otige ana magoso.
Okay, that.
So we go ati dosi ilikuwa we are 5 days. Okore.
Okay.
So you know when we are treating either bacteria say viral amarioga yoko we duration yoko make sure ya kilire ni elion skuru mobile.
All right.
So the moment you stop taking one wasalirie dosage liko correct clean up the body, so you might again become sick.
Right.
Negen tukende we encourage abantu ekere bakunywa mario garia otema kunywa amache amangi.
Sio soda, sio chai.
We really discourage kunywa soda na mabere. Maybe rongori, it's okay. But we emphasize purely want to tumia maji.
All right. For that reason, I'll bring you on board next time to what the do's and the don'ts. Because daktari Oigara kama uligonja oranga na ubuate mchangitenda atakuandikia dawa. Tutarudi kwako.
Thank you.
Tupatie dawa. But the most difficult part no kunyomolela hiyo kweli. So we will call you some other time to kuandikia. But for today, Naro Chenga Kisi University free medical camp Daktari Oigara asendo chimoja wakora mangana manga mangi. Let us begin from there, Daktari Oigara. What is this? What is the motivation behind your action for that medical outreaches program like this one?
Miyamono Sara.
Yes.
Medical camp gatuja na kueleza wananchi medical camp promosangira kana ya bantu soma gocha korwari gubosa gerero free okorwari gu oyo rwarete oyo tarwarete oyo advice no yo tarwarete na bago pima marwera tamaiti gosana bwate igoruguna screening screening nero ya cancer screening nero ya marwere ao na bora mayeto durwa abaga na prostate cancer abasoma na breast cancer cervix cancer ya cervix igo tokarora na university yaito ndowate School of Health Science. Umwako ko graduate wana for the first time wa okora medicine. Ndowate wa okora nursing. Ndowate wa okora pharmacy. Ndowate wa okora public health. Ndowate wa okora medical lab. And the vice chancellor ito now declare na health the niche of the university, especially cancer. Kwa tokarana tika tu warana into medical camp tuwari abantu baitobosa ande to abantu bamanyana ntobate abanyagitari university ande ko samtero abanyagitari tobate consultant designer iko tika abantu bache barwarigo chi medical camp jira ina mengi nero medical camp ere free buneya nero ya surgical camp yuko baratu nero jiro cha screening wasa iko chata korwari akini wane iko cha korwari mario na togete naro na bantu ko some go bare SME health education na screening aboko bara na uto cha book to mai ko cha korwasi surgical camp baadaye.
All right. So ikirengeke no services, free services.
Free services.
Chico to ganitari. But muchire
doje ko jitwara ali university grounds aristogora kwa graduation. Pavilion.
Okay, Daktari Ratemo. Daktari Oigara amesema from Kisi University, and is the biggest stakeholder. You're a big stakeholder from KTRH and from the Ministry of Health. What brought you together?
A medical camp in collaboration with the Kisi University na indotokoroka Inca Medics.
Okay. Inca
Medics.
Okay.
Inca aba nabanyagitari bonse pi abagusi giving back to the community. So in this medical camp etoko encourage kero montache. Kera abanyagitari mbakaro abanyagitari they are willing. You know the best thing Sarah maybe utanya kumanya. What the community sometimes figures out is doctors are not friendly, are not social, but we are the best social people. We are the best social people. So we are bringing in this medical camp to the community for free. For free.
Like free.
Free yani yeye mtujoko ko make sure we kire area. Yeah. Okay. So we are giving this medical camp for free.
Okay.
Including bagocha bachekiwe. Aba ruira bange babere maybe bako boli nkayito kaina kika anda igundore Dr. Oigara. Na kinda nyore Dr. Ongechi, na kinda nyore Dr. Matiko, na kinda nyore Dr. Imeke. Now these doctors will be available for free. So na bara ikegate na bona yaya tinte tikoro o imekende tendore Oigara tendore Ongechi tendore abanyagitari bakarwa bange. So it's a free service to our community. Umugusi in general na abali bali in our community. So what we encourage abantu bacha subungi. We are ready, we will serve them. To encourage medical camp chichinyinge within Kisiga. So to arore na chigo koreki chigo konya abantu baitu.
Yes.
Amariogo na karo. Tima teseri swali ndiche lakini umuntu namboreti. How moko ensure marioga ya moko for donation are up to the standard.
We will reach there.
Thank you.
Reach there and we'll go to the Of course, we can't do without that question. Yes, exactly.
Be mentor, I go to county. Elindo hold the medical camp. We can only permission the county director of health. You go county director of health and the permission. Get the county and case you go to Guruadia and the case we can say the cardi money. So, but the river and the Managitari county barrow na Kwaiwa. Korunya kitari etenena manage sub county and ikwa iguna inka medical association abanyagitari barwete gusigo senya mira ko Kenya ngima and the association ya ito ya almost 300-400 doctors iko baro bagocha all over around 30-40 ikabanyagitari baro baisaini ngoza abananchi bacha kwa wingi barwaligo.
Ndio sana daktari Oigara, daktari Ratemo. Daktari Oigara, this is a good cause, all of you. This is a very good cause. Inga you are giving back to the society. Bantu ba buganda kwanda galaxy daktari Oigara mono neshwesa ng'enkuru people stay back at home.
Yes.
But mono ekambo yega, how are we sure na umwana w'abantu banyore this information to make them aware so that they come tomorrow. Namokwanda with all the stocks of medications, all the experts, then there's no people. How are you making sure? This is one way, of course, watching TV, which is very good. But now, how are you making sure from that exercise?
Mbia mwana sori swali mbia kwa woni rende mbrana ugotangasira abantu cyitira n'kinge cyo gutangasa eta ya TV ne wate audience nena abantu already bamanyire abantu batangasira cyose kikanisa kibrocha ngoenda kire round na rero bosongoga wanafunzi wetu ngweta bale ne bana korokina medical camp ne rawankyo igo ne rero ndo bwate na social media erekerase igo abantu sokumanya bamanyire nande batari baketika barwari barwari atakora do screening testing abande health education yogakero montage kwa wingi ndio bakonyeke ankyo mama
daktari Ratemo abantu nabara mwini event yiga ire ko Kisi County Ondolaro Kalanyamira ari makuru tumagwagwa ofile tiga was part of this event. Mbatu kimokwalao waje for this free medical camp in Kisi County. And the one from other counties and they access this. Usebe no new Kisi County na medics.
Yeah. Amine nalia. We treat everyone who comes in. So a medical camp, like there's a power of social media.
Yes.
So even people from the US, people from Canada, I think with them a medical camp so we allow everybody. We will allow it's a free medical camp. And for us, it's a universal thing. So when anybody comes there, we'll serve with passion and love.
So welcome.
Kila mtu wako welcome. Kila mtu wako welcome. We even welcome dignitaries our MP take this opportunity with their people around. Anybody, because the county governor and the county government with the governor, but with the permission nana key to give back to our community. So we are ready to serve everybody. Yes.
All right. Daktari Oigara, wacho kuligalia tingi ngeji daktari Oigara na daktari tukuiba ya garoto watu tukulichesema I know Madam Roslyn Oigara atulugeti sana sema biabono na wanyitali ya bangi ya daktari Emma no you to make I know is following ekagera neno musani media sana kwa muleta ndi matwara gamba amagana yobo chenu na bana abantu bonse kwenye Mira County balibara abanyagitari n'abananchi imete mwezi muto watesema biabana kuwato kubolia igoro ya the biggest free medical camp eyo corona Kisii University wata na income medics wata na county government ya Kisii mpaka nyekitari na ya KTRH camp eyo migera sengenjo yao ngera nyekitari barabuda okay sijui kama wanajitibu lakini rende ya bisala dinga ya obyo boiga bantu wetu twararo what made them anyway yana montrano nyekitari kwa mateka no kwata chibisa. And I want to see when you're on the now this is the right time Mochi as a medical camp. When you want anybody about the medical camp, you are free to ask your question. What did you do? You want any condition right now? You got what experts make as a studio, the one that's still like a chinke. When you're a Dr. Oigara, when you're a Dr. Donald, you know what you have to do. That or what Dr. Oigara ne benefit and they got to what with Facebook to be ujumbe yako, mtasoma kwa niaba yako, ineli bodi yao, mtawauliza kwa niaba yako, and to school asinjira ebyo Ongechi gimana. Daktari Oigara, asa medical camp yega mokora ngwata bango kolingo more naroje chronic diseases na prostate cancer na whatever abantu bane baro oranyoleta tarwaleti but nata itogocha gukora screening egera emanyekane egora lese posta naroje it's cancers prostate cancer, cervical cancer, prostate cancer and other chronic diseases and tomorrow bara then me I don't have this condition then I'm not fit to go for this medical camp.
Biamano Sara, kwanza nda hotevi mono tuliko manya kwa sino ruarite. Again, the one blood pressure, mono tuliko manya kwa sino kwata hypertension. There are no symptoms. Igo chako pimu pressure yoka. No nyane sukari, wanto tuliko manya kare sukari kwa chaka. Upimu wale sukari kosa ankyo. Pressure kwa chako pimu kosa ankyo. Abantu baso migu maana ya afya. Muna wako menyabuya nutrition counseling. Counseling igore ya public health. Yoka gisa no kwerenda chindagera kuno koli aduna nate abantu baro bako beranga batamaje sembaro wete gaga yocho olingori no yakore yote buna embioni inere ye kuna screening and kuna corporate social responsibility yani university na county university erure kurwali abantu ninje kurwali abananchi gane kora baro bago chaleito kwa chibesa chibone. So ankyo ine opportunity yo kurwali kubosa ako chera rukabisa poko buroire wagandare ebesa ine bolit insurance yuma chacha kwa una chire oseiga outpatient yabante bagwa kana cash sha inpatient bagwa kana karore ward ya there's no problem igo tigara ankyo manta bacha warwali kubosa bachumbia opportunity warwali igo ekene opportunity ane for Kisii University
Ratemo is this the first medical camp in collaboration na ababata ni abaina mwensipi as Kisii University ose mwara college ananyo mwara chi college how is this one going to be different aso chama mayaba mtukucha
this is the first big one to occur in collaboration na manyagitari baito ba Kisii County na the Income Medical Association and other partners. But they are partners na bango to wete to medical sango katore stoko mention. Partners baro. Igo this is the first big one. Others we have been having small camps in Onchiro na one of our nursing students but what they have about screening medical lab students, but what they won't get in the past. Association Chinda. Again, this is the first big one in Kisi University.
Okay, that's very okay. Dr. Ratemo, this is the very first big one. But this is the biggest as well of experts from all around the health officers. How are you going to make sure that Quando io passo un kwanza alimo ngoje kama bagando cyari pimo modalo atakata pimo alingata ita masomo daktari Oigara mentioned doing education asamara yo cheno but bono I'm wondering modalo achimambia to kila wate condition. So how will you make sure that out of this medical camp Oigara to a continuous treatment when more identifying problem now it agete continuous treatment no mondo iga na kimogo chiko make sure you are following up as a result of the medical camp yotali atinegita mwamanyire na what very chronic condition it agete continuous treatment. How are you going to make sure you are following up with the patient, make sure he's on the right medication, appointments and the clinics to make sure that you are monitoring this because ekine kike take the medical camp liga.
Thank you.
Yes.
Ekeroche we came medical camp really. We have structures. Structures in the sense that na wasokuru wali murango ngobikura se tokoroke triage.
Yes.
Where we can have maybe part of education as you wait for the process. Also say wandopimwe sukari pressure kurwali omanye bona munya itari kyo chikora. Am I going to see a surgeon? Am I going to see a physician? So there's structures how the movement will be and how every process will end up. In case you come the first time, God forbid, maybe you have prostate cancer or you have breast cancer, all that, and we have identified that problem. We have liaised now there is a lot of stakeholders. If this case comes in, like now daktari for the surgical case, he might refer them to KTRH or any other facility within the Kisii County. So they'll have their follow-up, followed up.
Yeah.
Like for instance at KTRH, to what a clinic Kiabagaka,
yes,
which is done once a month and on Sundays.
Yeah.
So these wazes abangina nabagaka boche bale baikaransiwa abanyagitari mbarali babasomi babakora ibisayisi bibere bitatu igabona babwene gukora babanyonye cyaye banywa which is a beautiful thing that has been initiated at KTRH. So in our medical camp, which is the biggest, there be a flow. So ntote tiba na inchi bache kobo amnana ki ntogo ikera ntoko ruwali ntoko koraki neka bangire chi amanchiro wada nebembe we are set for the day. Yes.
Adikidamente se follow up yo kwa bole na kidogo ja ko follow up kwa igure rifaro nero ande buno murera go so agari atara pimwa details chumure kero murera ngo ligari details ya paka namba jitsimi igo even the bios go jibere ko enter into data bank kurwo aba oyo rwa de mano na magwa ke bisimi onyo tara gende sabo ene to genda ndorgo chikotigara yo we shall do book them special clinics in the county follow up now in the so the process has been is enhanced and it will happen.
And again, yes, maybe a Canada,
yes,
we are encouraging, which is the best thing we've been doing, that our patients watu wale insurance ya SHA. So you know now, like now it's free registration ya SHA. Kwa manya kubangana kio koraki how you pay. So we really encourage, and the SHA team probably will be there, so that we register the patients. You know, bandu bakobwa enteke ya chitigi serikali chibese gito getete gotura nini. No, there's a lot of information they are lacking and misinformation. So we will be there. We will be there to tell them the importance of an insurance.
Yes.
togote abono tiganganye mpaka next week ngoje konya chibesa hapana. So we will also encourage them to come up, not necessarily you're sick, you can come up, register with SHA, ask them questions, and then tumanye na kitoko koreki to
you deserve to have there asa mangana SHA morango because as we speak our viewers into Oigara balenga mwili gitungo SHA daktari ngara mwata vile ikanto veli antu bagateba. They really said mimi sitaki kuregister kwa sababu nimesikia fulani amesema haifanyi. Mimi sitaki kuregister, hiyo ni scam. People mbara yegedanga we are with the SHA. That is what we are with. Nani yegedanga kwa dana wana dana HIF. It is SHA. Wana wesu mwata vile nga registration nekaro tafadhali pia wanapata and you make sure.
Yes.
Yes. I was wondering, we will encounter a lot of crowd. I don't know how you making sure that the neighbor or get you mundo isani matana ngitokera bijja kusanga baro bakuwa abenge ndege bano waje batabege bana chiri nyagitari so ndege yache bamanya ende nkemanyano. So how you make sure that kila mtu atatoka pale akiwa anatosheka kwamba tunasema tuko daktari
biamono sara andengo irora magana SHA tiga bantu barigese SHA ngo korerega sininche ngo bara maida na SHA ngo konyere sana ego alafu ego ya crowd anjuma abantu tiga bachi kwa wingi ndo watu mpangilio there will be crowd control from there flow never angire kuro amari organize in abantu ba friends and all these partners abantu ba donate ya mariogo Oigara is a free camp. We also look for donors amari organize in Oigara ndekana no korwali abantu iko amari onaro digabanda abachi barwali onya security ne kabangire flow ne kabangire crowd control ne kabangire.
Perhaps tell us Dr. Oigara the function inaanza sangapi Raymond amanyenga it will start this time registration so that abantu baje mapema Oigara early enough abantu banyosha saa 6 mugusika saa 8 it will be of no use atobanye nake procedure kale ali abantu bakolwana boro
function ego chaka ko saa 2 twaigwere bita abago ali geita main gate ya university bajari se graduation ko bara no saa 2 ba saa 11 usesa abantu bakwerera tiga abantu baje mapema ubuyaba abantu baitu buna gusiga mba metiko boka abantu bakoro transmara na bona bagoboka mapema mono kunyara baikire clinic saa 2 igori nyamira bose abantu metiko tiga baboke bache tukere mbagenda mugondo bache barwari elinde to barwari.
Okay. Sana daktari Ratemo, now give us the services tulizokwenda mbali na chichira se posta tutebinga mapya iko tukuligereri A to Z diseases tukuligereri A to Z tunatigaliana se posta.
There are a lot of services, Sarah. Yes. A lot of services. Now, if Dr. Oigara can also say, it's maduira wao. Abogo chokage bono nchurire wana pressure ngo pemu pressure mbwate uirane otebutu bwati pressure.
Yes.
What you have is a mental health problem.
Yes.
Stress and all that. So ntobwate na kitote bantu kabwate abanyagitari wa kila aina bako umunyagitari yo nutritionaro in case somebody differs your weight is overweight or underweight or nini, you need to check. So again, the privilege will be there.
Yes.
That either the other doctors who are there, the other consultants who are there,
yes,
now they can be having a lot of consultation. Na it's a surgical case but also needs a consultant. Na wako mutuma se consultant. So the doctors there will have a privilege. Abo mubira gocha sende morore. Kena morore na mukore. Mutume ase Sarah. Sarah can see and also can tell him or her to come back to me again.
Yes,
so nutrition. So nutrition team will be there. Pharmacy team will be there. A lot of consultation will be there. We also have our psychiatrist, mental team will be there. Then we have dental team will be there. The lab team will be there. We'll have, it's a multidisciplinary team. So muhimu roira aliyoyo ikate naenda se Dr. Oigara surgical team. One the team when etikobaru yabono na agenda ndorege se Dr. Ongeri ndo se Dr. Meke se matiko se nini. They have that opportunity. You correct. You go pass from one section to another section. A team yetu ya lab nekaro, which way we'll have various lab tests chigokorwa. And I hope our lab team can have a department for blood donation.
Yes.
You know, we also need to give back to the community again. In Tevantu Togocha, Tobaruario, Canabora, the students will also be there.
Blood donation, Nekaro. Blood donation, blood transfusion,
yes.
Otherwise, kwa bodi marwereki tokorwali abana bakeno no rio one day old pakabanga nabagoto dokero monto paka pediatricians kero kila mtu is there amarwere screening amarwere ya maiso no KCI no bakade partners amayo no bakade amarwere kuba no ere kuba enda abandorera ukwana bana gose barwari tinda cyalsa watu bakorengera ne cyalsa screen mabona tegaje bate ko man kera banyagidari baro bari senior.
That is big. Oigara Dr. Ratemo no matter I can attest to what you again. We can bambia. You've never seen it anywhere. Because you know, these are the people who see us. Okay, what they want specifically and what the doctor will die. This condition. Specifically and what the doctor will die. Specifically and what they will be there in one basket. Kubashughulikia nataka tukia chini mwashughulikia ndo osielia amapata ndo daktari bali osielia na igono mpaka benefit mono mtoto we just justifying what they're doing. No, mwashughulikia other things na ande people involved over chenu wao. You should not take that for granted. Just go pimwa ngantire daktari toa some of the feedbacks abantu watu litasema bia bono wetera system ya Facebook aneko ndande YouTube aneko chana SMS number naba kyagera ndo chabanteka wegura magana ali kitoko chene. They ask a lot of questions and roll that walking roll that okay, but we need to answer them because they don't know. That's why you are here. Also susu awata birenga olimuto ko susu agenda candidates also lesson jina ya kishabiki awata anatolete kwa Nakuru City Salams Club. Asante sana. Nyama ya Clinton awata were watching live from Sengeri. But some health camps are very good. I support them. But some are just scammers. Jukuna wenye niliona somewhere na ni hospitali tunajua vizuri wanapatia wamama wa kijiji mzima specs za kusoma ambazo sio sahihi. I think everybody can have it. There are some camps nchile chingia na very genuine for scamming. Because out there now, Roche camp with Dega, Ekalakuava, and Gavon everywhere. No, you might check out, not everyone should receive everyone. But they have a very teaching man. How can you answer him?
Okay, on medical camp, Genetica, what over Kora?
Yes.
banyagitari bari trend gutwara ko babakora otherwise abo makora morwerera abasiko kurwara mano gose usasire lakini esebi asara maybe ibintu nebirora tinkumanya usamante kwa gwibirora batapimiri abutinkumanya kabisa lakini yera begente ke besano nyege karo lakini ese ntuga I think ero mutana baite innovation center kisi ayo eliera ali nyanjwa nere kali gotenda mwana ya maiso they are partners with us and but they are professional. They are headed by Professor Kiage and they do their work very well. They got Kisi the county referral, they were the consultant here, myself, Dr. Clarice, and the services are above board.
All right.
You go ese kambi mne ya bata banke banyagitari yange bintu nebi okono kwero twero there's no direct benefit esa banyagitari kutatika koruali aba give back to society banyagitari aba nchi na with the tax ili ndo tukasoma.
All right. That's okay. You can add something to that.
Yes. First, I concur na daktari and I apologize if that incident happened kwa bangini birore. But again, we are offering these services for free. And our part of services is integrity. Yaito. Toba toteni na ige TV muma ochokwe una twenkwana na ibirori bibe twenkwana na isena marioga mabe these services we were not kind to people. No. Because after we sit down and we have agreed to give these services for free, we want to do our best. Nyasaya tutangane tusaba wananchi na mulembe metakire. Yama.
Nifote mauza buleta takiri. Takiri what's the time? Buleta takiri because you have good hearts and let give back to society.
We are going for them.
Sitting at the hospital and wait for them.
Yeah, yes.
Kendi Sophie Motangi awata banara malaiti kwenye conjunction. Morning ni John Amoma worker at Nyangena Hospital, watching you live from home. Nyangena Hospital's TVs are on, watching you live. Say hi to my senior consultant, mentor, dad, Dr. Oigara, live long, doc. Many. John Amoma. They are on. Nyangena Hospital, how are you? Thank you so much. Esther, last drop. Awata medical camps zingine they are scammers. Hospitali inaleta camp kwa kijiji, unakam ku complain like signs za UTI. They tell you need further investigations. Wanakupeleka inpatient like 3-5 days ndio wapate pesa ya SHA. Some of them aziko genuine. But let me now remake the report ya kuna minute usibona na understand. Daktari mambia murwire nache aseka. Then when your condition yaye telikoera raga ase medical camp. Ne nategere further investigations. Ono esta akagetenga mchamambi akoda nimata UTI igate mama mariogo te there aendeka anyumariga yobwene. Tatage tipo motai further investigation. What are some of the conditions chiragere? Motai you monta of the medical camp mambia ingana tokwa you still need to come to further investigation. What are some of the conditions chiragere mokore?
Ndia Manosara, litangani tiga na understand ki amenity scamming erona nyagitari njiro chikwanda gento ko na marketing market chikwanda ko market kina karore sana the private hospitals go and the medical campuses with ya chikori ya barwaire in quotes and ko market which is okay lakini mbara of course bara takako abeke ward elinde wanyawale chibesa ko ruesha so it happens. It's not a good thing, but it happens. Lakini ya ankyo, it is a public medical camp by the university where any hospital which we are and especially to the government hospital.
So there is nothing wrong.
There's nothing
telling you need further medication.
Yes, with open arts. There's nobody marketing anything or marketing a certain hospital. Just to offer services. igona ndi kwa bodi na marwera ali turata admission tonya romonto wate enda moromete boro usama ramin na ibe baro bara chego chihani age even the take surgery we will refer them and the what refer forms and the to body esa take ko gan dori to wate na gan okay so take ko ngandang to tomorrow no ruade teiga sincere to matena sincere tari na ko se marketing
so at some point you're saying in America still you observe a patient's rights
very important.
You have something
yes you know, a patient can be referred to an hospital, maybe on what the doctors have seen the conditions. Like Yonyaro, what the UTI were referred to hospital. 3-5 days. There were maybe checkups. Yes. So we wish we could have known how the end mat was, but because aliambiwa aende hospitali angaliwa pimwe, we really don't advocate somebody to be admitted if it's something that should have been done and a home. But again, there is a referrals. Could you upate mtu maybe the patient has pressure or has a minor thing that need to be checked again. You can be medicated for maybe 5 days, then when you referred, come back again. So if the incident that there is no change, we can also able to admit you, then do more checkups and see. So sometimes we require them to be patient. Nobody is a scammer, anything that comes in, but your health is very important to us. It's very important to us. So kindly be patient. The issue of insurances, there is insurance with our own for teachers, which now like in our public hospitals sometimes you may not be admitted. Tatuma when the bleeds. So let them not scam that Dr. Ratemo or Dr. Oigara or Tommy Breeze clinic care. Yes, your medical health provider, like teachers. Now they have to go to Breeze. From Breeze, when referred either to Oasis, to any other facilities within the county, patient prevalences. So let them know that again the insurance will dictate where you're going. Yes.
We get you. So Baba Esther, last drop, the time we go to buy a selling Talma Mocho, why came up with know what the condition is that when they are giving now we refer to other medical facilities for further examination. One of you were already, but you are working on again, I'm being referred to another healthy facility. Jonah Mom, I must attend this camp, so educative. Thank you so much, Mambia. TV. Now I'm here. Thank you so much, Bahrain Kingdom. Roslyn, Yakona, David, how are you, madam? How are you doing? Good one. You are sweetheart. Roslyn, Yakona, David. Thank you so much. Well done, Sarah. Thank you. Esther, last room, watching from the common primary, audio. I am a qualified RCO,
registered clinical officer.
Registered clinical officer. Naomba kazi hiyo ya CAB tushughulikie wa Kenya. I'll be proud one.
Amekaribishwa akuje.
Ambe she's most welcome.
Esther, the last job. You're most welcome. Daktari Oigara Ratemo, Daktari Ratemo. Andrew Matunda kwa Nyamira Town out there walime. Ongera Justin Korwa Enchoro ya Kusamaro watching live. Dennis Okioma, I'm ready to volunteer. Thank you so much, Dennis Okioma. Just volunteer and do the services which are Bantubaito. Brano Nchuru, Atavira Natoli Kurechisochi Korongo, Yaribari Masaba, logged in. Abomba limoto watati watera sensemo ya Facebook. Ngantele Daktari, sema ya YouTube tunaramba ibato ligerete mtu basikerera isiko kiagera a lot of people are following us through online platforms asemambia. But before that tigana enda say SMS oyako kwa hello watching me right away. I'm Cynthia from Mosocho, was diagnosed with the disease called guy GERD or GERD, G-E-R-D, right? I have been under medication for long, but this pain is still there. Will I go for OGD again?
GERD immediate gastroesophageal reflux disease yo abantu bali bagwate kyongoreka onera depending na pain ya gwate ne kyongoreka pain kya minute ko ne pain yenda ikyara GERD tari ko se pain yenda ne kyongoreka korenta kuna bora nyore GERD yo ya na bonya ko ya roreka te endoscopy lakini tari ya korenta pain so again ja gwate gocha na bona na gwate gocha ma ankyo atorore. Pain may not be related to GERD. GERD is a condition maybe recognized endoscopy. And now what I thought GERD, to a video, got the go to the terrain and the mechanic some of it. So pain in a very and take care. So then be agile, the endoscopy, the agile Romanagitari.
Okay. Thank you so much, Baba Cynthia, kwa Mosocho. I think daktari watebringa kuja kesho uangaliwe kwanza wanadamanye kugwatia asasa ya YouTube nindoche abangi modulate kwa YouTube kumeta TV na ndeka wikiralia genda subscribe gai wende daktari lazima hapa ni juice pia mimi so ukifika pale YouTube subscribe weka notification about the Nyata Breakfast Show ya chati na sala nyaragetisha na Brighton Makoli imurulinde Nyata TV engere of one of our members as Etaya TV. Akon kwa Helen Moturi, I want to have a good work there. Salimia Daktari Oigara. I will share this information to our mothers wakuje wasaidiwe. Please do, Heleni, be the ambassador asili tukiritikali kongwa nkemambia kili achire na nito kumanya how long it will take for it to come. Ige opportunity kia achire, just take advantage of it. Mochi muligeriwe amangana manyekoba urungi. Ase bali mwenda tukuto buwate se enambe yu WhatsApp. Nidoche bandu batolike WhatsApp akoro kwa kila Dennis Corona Kuru City watavira nwali ma watainga kwani daktari Oigara kwani daktari Ratemo. They are very nice people. They are really giving us very nice piece of advice. Thank you very much. Asimambi ya bono divile mora na dolwetu kwa South Mogirango ara seskuru ya Esaka Primary, about the Guanya Baganaita studio. This is a very nice sensitization about the Vaito Panyorubu. Thank you so much, Madam. As well to the Ejubiao, as a Imambi Yabono. And one thing, but more than the Polica, want to go to Jaka Bisabana, here medical camp, kuna orthopedics. Will they do surgery ya orthopedics? Please inform me. Nijue gaki. Lakini also wakora ungetuambia jina lako nasi orthopedic but aizuru daktari Oigara daktari Ratemo. Will the orthopedic department be there and will they perform surgery there on the ground?
Surgical disciplines once novakade orthopedics eminenti surgery ya mauga surgery awandu barobna to surgery general surgeons. What we have tomorrow is purely finding out like what the surgical condition. I think we are planning a surgical camp, purely surgical camp. I think some months ago, I was last year to about the orthopedic camp na KTRH, America. So we are planning another camp this year, surgical. And then I think before the end of the year, Nonya cardiac surgery, open heart surgery, so depending on the we want to plan another camp for surgery. A year of my even a weekend. Surgery over several days in one day. So that's a plan for the near future. Now I go referred immediately for an immediate problem. The surgeons will be available for advice.
Daktari Ratemo is raising his hand.
Yes, no. Thank you, sir. Yes. What I mean, for what he has explained, clearly, like we have plans for our people. we went to open heart surgery, into surgical, purely surgical. So, like what he has asked for orthopedics, orthopedics also needs to cover amount to get people.
Yeah, that's right.
Maybe not get the chip plates or something, so they should also check out. So, but what we encourage, let them come. They are with those issues, so that again we'll have our data. To collect the information naki abantu bagendere tegocha. And again one more thing, with few medical camps, with association to the community.
Yes.
And then chomateninga nchito mopira na achire binyoro mari mpira. What I've seen, some parents yese abantu bande baboire koleta abancho baba barwarite.
Yes.
Ese no mugakomino rwarite for a very long time. Batete komoleta nyagitari ubusoko. Omwana geso iboire obwate some abnormalities. Batete komoleta mutu arwariwe. You know, we have seen so many people even chain their kids at home. So we want to tell you in general or anybody that we are free to see anybody and we are free to advise. So abantu baitu tigabache basoke bagoke nkoro bache abanyagitari mbakaro babaligereri babakonye. Thank you.
All right, ndiyabona sana. Na into tolenta medical kamba iganyamira samumabea. Babalota bakonyamira na into tolenta medical kamba nyamira. Yokumudeta.
Ngojere is part of the plan. Ya nyamira ngojere ngojitobate bitaliki bwango iga. Lakini esa nkyo tigabaracha barwali usite bosongo teri yare ko nyamira.
The next question is for all of you. Dr. Mwana to do you think this medical camp bridges the gap of health care access? If so, how? Medical camp but you know from where you sit. You know this medical camp bridge the gap where I say accessibility and health care survival. If yes, how?
Now, okay, a medical camp in Nyamira never planned for 27th of June. Yes. Confirm. They are bridging the gap now they now want to buy but they will they'll be assisted. That is already bridging yes. So screening you health education because some young they go health. So that is bridging the gap. To assist the daily treatment.
Okay. I know from where you sit with all the pharmacy, yes, consultant, yes. Say you will be giving medication 1 times 3, 10 times 1, then you will give that knowledge.
Thank you, sir. We will give the knowledge.
Yeah.
We'll ask the patients given instructions for how long. Again, on that same issue,
yes,
we request that all patients warenka na mariogo wasiache nyumbani.
Okay.
Norwata marioga okwa tunaroiga atare naro. In case the pressure or the sugars are not going down, yes, our physicians will be there. So it could be easy alternate to another drug, dose to reduce.
Okay.
Kindly talk about request about na marioga gabekine bagi risakara bekego time abeke bagi me achinaro tocho tobasome na marioga gotemeka na kyabwene gotemeka in case yakere ibiri yogokunyi.
Okay.
Na kyabwene gokora. In case obiro nyura marioga birwent konyelimo na kyabwene gokora. And back to the issue of breaching the gap,
yeah,
already a medical camp where we have breached the gap because the gap where people now will be freely towards. Ignore this issue, ticket number, go to Windows something or need get so we can doctor Oigara what they call what they see so cheat theater. Now they love in live. Teri necessary nese n'orware tenini nchuro ranyanyo munyagitari Dr. Oigara mokwani munyagitari mbiyore na okoro kuigara kware nayo okoro kuigara nayo okoro ku Dr. Ongeri nayo okoro ku Dr. Imeke. You know those names that you have heard and you have longed to see them. Just come and say biyande na takanda royo na Dr. Oigara na ra muibura matukamange biyamona. Again, on breaching the gap, you don't need to be sick. Maybe ngo achite nyagitari yo Oigara gesengo achite general tugakonya. Just come over and say thank you mwankonyete na acho kubaira ndimbi ya mono na koreki. Yes. Na bweni rembi yangenderete.
Yes. And by the way, ntwakora summary. Tumanya nguchemule tutakumanya feelings jabantu. We got all challenges. There's another organized this free medical camps, but this one is big. What are some of the challenges they face? What do you think people fear, even going to this free medical camp? I can highlight the comments. Fear of reality. There's some reasons fear of reality. Some guys don't like negative part of reality. The fear of old a lot of diseases more than pressure now what stress. I wonder the fear of not having money. I want to free medical come condition and they don't have money. You know the stress mapema hata kabla ya ile ugonjwa yamepatikana nayo. So you see, watu hawataka stress ya kuambiwa uko na ugonjwa more than 10. Not wanavocha mtu wati umenyewa solugo wati 85 diseases. You discover you have 85 diseases. So you see, these are some of the challenges that Ratemo we have. And if you look at them, they're valid anyway. But now, despite all these fears and anxiety and lack of money,
okay, I hear them. I feel what they are feeling.
Yes.
Number one, I want to what a terminal illness, about the HIV, about the cancer. Like in one of what really. There are Marioganaro, HIV, Marioganaro, there are 90 years. But they recover cancer, they don't go to talk mapema, a killer, the Yaman to buy which are late, which are stage 4 in living to get over screening, or I won't go up on mapema, or our and go eat. You didn't work on you. The Yakabina, I want to borrow. I was here to go over. Every maybe I got with a diagnosis. One of and John Adiago confirm was no man, never do. Was nobody more. And after now, and I got our own go body. And then I believe in get a will see, was around the guy, Lamont to Taricobar. And about to know Wacobar, no month 100 years, Wacobar. Is he or she strong enough? And be a work and be a work. When be very strong enough, I would take a machine and I will be a girl named Korea Ego Corregas. Go one to Mao, one and Davago two, Valente guitar, Takumatia, no, to Moira again, never bad no more. Than more, when that worry, no more video, Naruko, they don't go with
it. Stress. I'm happy that talk about our psychiatrists, doctors will be there, so they will actually explain you. It's more stressful not to know what is going on, just keeping quiet. So mbuya omanya seme chandere stress now lowers down. Nyonye bukongo tebere. Lack of knowledge have destroyed my people. That is Hosea 4:6. So whatever muna ekerura manyoburire bwago, if you go through that process.
Yes.
My friend, you'll be more or less stressful than just you hide. You know, like Monto Tevi Gumna Wana, you might take once in a Korea. Edo what the TB gets HIV. Then now you don't want to come forward because of the reality to know, but what come fearing on. You know, you get now pressure comes up, sugars comes up. So it's better.
You develop even more
conditions. So it's better. So your come in, check out. We have now good machines for checking out TB. We have even self-test kits for HIV/AIDS, self-test kit for sugars, pressure, and all that. So that is the first disease Mondagotua.
All right. Because we asked a question on the topic, ukilemewa zaidi na uambiwe sasa kitu yenye imekulemea ndio hii, bado hiyo ni reality. So wanjira ni reality.
Yes.
Kujua mapema lakini kwa sababu ila this comes and but kwa addressing abantu bangi muluta kama zinalita because of ABCD itukulianjo ina amangi tomorrow at Kisii University utaona daktari Oigara, utaona daktari Ratemo, utaona daktari Mekera rafiki yangu, utaona madaktari wote, utaona watu wa SHA, utaona watu wa damu na tumwenda mungu kwa manyinga na tukubete daktari kwa manyinga mangaro utwara mangi excess bro, you are healthy.
Ena bara kurwali andera depende na kia eternity. Okay manyinga wana karto kwa ikorea manyinga tote ko cells. Red blood cells or white blood cells. Jiri nyingi. So na ver cancer na ora twali ko lenda twara blood cells nyingi. Iko na ora te lakini baro na ndo ko ba healthy ba tara manyinga mangi baro. Imbaro very healthy again don't go HB when you was 18 the normal is 11 to up to 14 that one is still normal everyone don't very healthy go and na maigu the blood donation ne karo te van baru manyinga that's ba donate manyinga o donate na ko konya bantu igo very healthy.
All right. Thank you very much. Very nice. So we are running with very few minutes to wind up. We hope ungamambia wabaroma nende waba Kenya, waba Ndugurugisi na the surrounding counties mbata ya mbaligo chewa. Hautakuja kusema nano wakufukuzi hawezi fanya namna hiyo. Hiyo watakwambia nano kalia hapa. Igo muo wamota ngi they are here okonya obulima bw'abantu okonyo manyengi kiwukuli odaro chire opimiro da bukende ngeyo partner bayibote ngana arwalete isema because you are an expert okwera sabuyanga daktari inko iwero on mayapa right ento yekumbetira na ndo mende barabu the more you explaining the more banyole lichiwe deka unokora kweresa obanyire kiyekuliete you imagine yaani unaila leo mjamiani nimpone sababu unajua tu shida ya mtu kaga ndio kueleza tena sawa kwa nini nataka endelee kwa menta matuko Nancy Kerimo Magolia whatever live from Australia ndio sana Dan Kanombano Nchiri I want to enjoying the show kwa tusemcha nyamache kumagacho basi enjoying the program so much ndio sana for the feedbacks kwa ndio tutumela chinyinge kwa kia ngatuko pamoja ase emambia bono leo kwa Evelyn Corona Rock awata nimba wata Tiwana Mituthri online kwa na Dr. Oigara. I met him long time ago but hawezi kunijua daktari na wala beta kumanya otebire kwa na daktari Ratemo mwama iga mange na ende ya saba sena singia indote Jona urachisa mwachia ugembo abata my sister Sarah by the time I come from ugembo ala mbana wana bandigirete. That's very nice. Bia mwana kwani mwako Ontita gende mako maragabo abata nga asalimia madaktari wetu. Very sensitive and educative session esa tokonye abantu mwambie sokie mnyoro kulingulia wabosa na mwe direction bia mwana sana. Maria Ugao na tutikura Summit Junction au tabanga very nice discussion ita TV. Asante sana. Salimia wageni wetu wa nguvu ndani ya studio. Bia mono sana. Nawe igote vile kwa Leonida au tanga daktari Oigara. Unakaa sehemu gani? Daktari Ratemo, good morning. Daktari Oigara na sasa mkiona kwa sehemu nyingi.
Penye nakaa kikazi okay, nafundisha Kisii University.
Yes.
Nafanya kazi Kisii County Referral Hospital kwa sababu ya MOU tuko nayo na Kisii Council. Nafanya kazi huko pia operations plus private hospitals. Na niko na ofisi yangu Kisii Galaxy Medical Center hiyo iko opposite kwa Kimati.
I think hata kumanya nabara korobo regretare akiwa kali nyitali na kora koro akumia kitari. This is how they work. The private hospitals and medical services. I don't know who so long as you all the services. Pia mono sana kero toka endetega daktari talk of who are you partnering with to this noble cause. We need to recognize them and of course especially for tomorrow's event.
The biggest partner to what, of course, now Inca Medical Association, of which we are both of us are members, and the what, of course, Kisii County government through Kisii KTRH and the other doctors who work and nurses who work within the county. The what Avenue Bakarari, Chistan Javo, Red Cross, the what the partners were donatory Madiogo and other donations. Chibank Jatokonyre, Stima Sako, Waumini, Chibank Johnson Chirobo, Equity Afia, Igona, Alafre Chagtari, Chirobo Songo, the Barovago, Janamarocho, Java Hema Hospital, Galaxy Aito, and other hospitals. So partners now, now of course, though Kisii Hospital, it was an innovation eye center to be screening the Mangana eye services. You go partners now, Wangi, the convention once, other is Nashukuru, the partnership.
That's very nice. We need to recognize them. This is not a usual course. These are very different course. With all the partnership, I want to watch it now, but I know that's very good of you. And tell me talk about Mario. Mario, I am also going to say, is a result of the partnership.
Thank you. Sarah, we have partners who have volunteered themselves to give us drugs, like the likes of Dr. Tundo, who has this Phoenix Pharmaceuticals in Nairobi.
Yes.
Abagusiba ito wachirare in terms of production ya Mario, abanyagitari ba Minto. Then we have the pharmacies around the town, very willing also to support us through free drugs and all that. What I assure people is I'm just part of a team Tokoroka Pharmacovigilance.
Okay. Pharmacovigilance.
Pharmacovigilance.
Okay.
So pharmacovigilance, our main duty is to ensure the safety of the drug.
Okay.
Unanielewa? So that in terms of theft or in terms of what? In terms of usage and in terms of the quality. Mariogava original. Tawa fake. That's the right word. Tawa fake. And what I've ensured is for the last 13 years experience in pharmacy in KTRH, the lab, which is worth 1 million.
Okay.
A mini lab for just drugs. I can carry that mean like a briefcase and then check it. We have also gone through the parts of educative. I can easily detect the way labeling and all that is done. And we have also ensured that all our pharmacies were very aware Oigara fake in the market.
Yes.
We keep on pulling drugs every now and then. That you get a badge, get a number, get a more so we have also ensured that the medication that will be at the camp, our safety team, pharmacovigilance team will also be there to have a look at them and again to talk encourage our
yes.
Sometimes don't carry too much drugs home. Drugs are dangerous. Drugs are very poisonous.
What do you mean? You don't carry many drugs? You put it.
What I mean, oh, nothing in Joe, Netira, Buyande, Yangandengi, Kipanado, Kana Kuruari, and the Panado has killed people, liver cirrhosis. Then, Abande Manjata and Uncle and I was septri. Now you can cover Kambatira Kamiri, and with the Kuruari, now is septri 9. Like currently, we have a case of SJS. Steven Johnson syndrome. Eliogere ke kwali nyure rise ko react no mubiro kuyumugibo. Kwanya ko rumuntu sambiroro geseni ni yesena accident yabo geseni egari petrol ya tekasa abantu na bakuyi. That's how that drug does your whole body. It's something that you're not supposed to joke with drugs. Na kiyo te will let an expert give you drug. To bose ko mo kabono. Mwana olinkolirare na tu Dr. Oigara nangete septini nige gankorware lige kuba mwaga ntetera ko gankonyire. You might end up killing the kid.
Wow.
So sometimes na kitota are very cautious. Allow us to teach you, allow us to give you knowledge on which drugs you're supposed to use.
Wow, that's very yes, that's very, and that's what we do.
That's you said we'll have part of it. You'll have more elaborate and even show you pictures on what will happen.
Yeah.
But Amariogo, me as an expert, I also encourage people be cautious. Take medication as instructed.
By the
as instructed. To bose we kote bono na nyweta matuka bere nkabwana na tiganya mulyogayo. Mambi yaye umusani ogo gesondo rwarire mutebyo mwatenga nchukuigwa nchina bo Dr. Oigara Dr. Ongeri mekya ngete ryogerio kabwana kwa decide na yako koreki na nchuchu na yekanyi.
All right.
It can kill you.
Thank you. We will have you soon. Tell you adding something.
Kwa mboligo ya partners diati mbati otiga wandesiko.
Oh yeah.
The partners almost andi korokine university iturende to anchire.
Yes.
But we have about 26 partners.
Wow.
Equity Afya, KCI Hospital, Kenya Red Cross Society, Sai Pharmaceuticals, Mario Tamaniogo, Regol Pharmaceuticals, Sphinx Pharmaceuticals, Mayos Pharmacy, Jack's Pharmacy, Jimia Kenya Limited, Dawa Life Sciences, Avenue Hospital, Silver Care Medical Center, Eliana Limwembe, Path Care Hospital, Dynapath Laboratories, Inca Medics, of course, Shivling Supermarket, Beyond Zero. By the Beyond Zero, clinic, Fast Lady, Beyond Zero, Naira Ekaro, services, screening, no Ekari, Family Bank, Stanbic Bank, Stima Sako, Kusimu Alimu Sako, Egerton Sako, International Solidarity Foundation, ISF, Mwalimu National Sako, Robbie Water Company, na Fairmount International School.
Yeah. How did you get all those people on board?
Those are friends. Good friends.
No, those are good friends. We are good people at KC University. It is a big institution, and people also want to give back to society, wherever they are.
So Let's understand it this way from you. The one who have more than the Chicago supermarket, Stima Circle, Family Bank. If you want to know what I know, advantage by your account.
Abantu abanyamagare kobeka je not really doing the marketing na kobeka je standing out for opening accounts. Abambari bayirwete to support the camp. To support the camp. Maybe bagore logo ya ese banner it, then people will remember that. Yeah, lakini mbali kutwara na ji stand cha boga cho kora ya cho account.
Yeah, from there and ndoko na mukagira. Until we get the confirmation from you experts.
Yes.
Tunangukora sana Daktari Ratemo na Daktari Oigara abantu baitumuto watetia abantu. But nashukuru sana ebyomanya n'abantu batagete kumanya igoro ya afya cyabo irigiri bidike bache. Then what they think of Daktari Oigara ninchi pali kidogo cha na record. Ati Daktari ya Galaxy speaker anasema ndio comfortable ndio kuandaa abantu bya.
Makaribisho.
Endoscopy.
Ojo tobaro kichi machine.
Kabisa. So abantu bamanye. Bati mutaro ukwana ne CT scan okuminga what is that? Ukwana MRI, ukwana gosengi mtu ajui. Abacho kuiwera leka rumorero ya tabunga muntu natakire kwa CT scan. What is even that? We want to get pindi ikiwe kwa tunainchi sana ya Ontita nchimba tena tunacho going forward. Daktari, what are some of the challenges you encounter, you as planners of the event, as the experts? What are some of them more encounter, and how do you fight them back so that it doesn't hinder your services?
Thank you for the question.
Yes.
Nyombati tanya kuburu nyonye chumbi.
That is it.
So most of the challenges, maybe I can talk from the pharmaceutical side. Sometimes we might have some drugs which have been donated to us, and we might restrict giving to patients unless and otherwise further instructions have been given from the doctor who has prescribed the drug, which now becomes again another challenge. Another challenge again, we might sometimes run short of supplies, which might be a disappointment to latecomers. To latecomers, which we also work out and see how we can help them. The main challenge that our pharmacy team will have is sometimes how we issue those drugs. Sometimes we might restrict somebody who has sugars not giving a drug for a whole month. So maybe we'll give you for like a week. Some might feel disappointed, but sometimes it's give in and take. At least kero montaño reliogo, munari kero reliogo, achire nyumba. Yes.
All right. From that point of view, from where you sit and from the whole event, no more organized Tiga, that's a very cheap.
Oh yes.
Yeah. What did you encounter? And then I give more negative success up to where you've reached, and we hope it will be a whole success even tomorrow.
Organizing this event is not easy. First of all, you got the blessing of the university management.
Yes.
To work on the charity. I'm the university council.
Yes.
I'm now the university. So I got one permission here. You. That doesn't come in easy. We come more economies number able.
Yes.
To hold the university manyana go spend some money to feed the doctors that day, to get the tents.
Yes.
Even though supplies, get the equipment. You don't need okay. Permission from the county, from the security, from the county director of health. You go, if don't even go up in the background, it's not easy to hold the medical camp.
Okay.
It is can say some capital intensive kidogo, lakini ende nokuerua ili ndeto tokonya wananchi, and you have to push.
You must finish what you started. What happened on the background.
Yes.
You must show people that this thing is achievable.
Exactly.
Exactly. But just push, continue pushing. Asante sana mwegerere ko base kinyozi yeko Salim kinyozi kira igama ya yetu kene nayo konya ya quickmat ya imaira ya ontabiri salimia Dr. Oigara salimia na Daktari Ratemo, watching and listening keenly. Thank you so much Salim. Ojo del shabiki yetu kabisa and tule timu ya Arsenal. Daktari Ratemo na mwana ranch to bila then of the day got the yule timu yetu shabikia anye Daktari Oigara. Tika wana game sana.
Njeno Arsenal.
Wekelea hapa sasa. Mwana Arsenal. Wewe ni timu gani?
Arsenal.
Robert Kongo itatoro monto.
Niliambia mtu nini? Alafu na Salim ni mwana Arsenal. So, hatuwezi kuambia
mwana Shabana.
Achana na watu wa Arsenal. Leo jioni tutawanyorosha
kweli. Ni Arsenal na Shabana.
Shabana. Arsenal?
Shabana kawaida.
Achana na FC Leopards. Ndio Shabana. So tuko sawa. Daktari, we only have 5 minutes. How do you see the future of this medical campus in terms of technology and in terms of community impact in the near future? Because come next year, a time like this, we'll change technology and everything and this medical campus together.
In terms of technology, they're going to be even more sophisticated. One of so many digital. One of them in the registration to computer. Next time it will be computers. Carry station to computer. That is number one. The weather daycare surgeries, the pinhole camera interviewing it will be done on the same day. Just scan it, mobile. You have your scanning there, your X-ray, your X-ray is there, and then so things are going to become better. Even though you have a mini hospital getting into the whole day within one day. Yeah.
Now with the technology as it comes, even mobile services have come easily. So what I feel, each and everybody should have at least once or twice a year doing a full body checkups. Full body checkout. Somebody asked my friend here, Lisa asked Dr. Oigara, with these multiple disciplinary, with these many doctors, nurses, clinic officers, pharmacists, farm techs, how do you mingle? Do you guys know one another? Do you guys have a social life? He mentioned outside the bar, so not most of us go to the bar. What I mean, if technology now keeps on improving, next time you can do checkup in your house, and maybe to show you have a problem with your chest, you have a problem with your stomach, and it can even direct you the list of consultants who can do what, who can check out you have ortho and all that.
All right. Yes. We are saying the producer na just shout out that full body checkup. Abo debe kwenda Sam usibona ngorwanye ne wewe kana sibekwe Oigara Oigara ngenda secretary fulani usengo kwa combined full body checkup.
Okogenda Samo a comprehensive clinic. Most of these clinics is in town here. No, they to what the galaxy. The best in Chico signify so they can be done within a day, and they're gonna go and Samo. They're gonna go around. Yeah, you then I refer as a Korifa as a Kara Regan to get
Manyingo kawa checking. Let's just a blood check.
Full body checkup from head to toe.
To toe, everything. You go produce but beyond, you pay for that service. You want to go full body checkup free in a hospital. You pay, of course. Yeah. It's very free. By the way. Location in Kisii University. You have something?
Yes. Okay. I was just trying to, because of time, the issue of us socializing. We have various events, like now in the Kisii County, which we thank our leadership, health leadership, through our minister, chief officer, directors, Dr. Emeka also. We have what we call Afya Cup, which the governor supports a lot. So these are all workers, all health care workers, including Nyonye watchman, including Nyonye nurses and all. Everybody who works within the facility, accountants and all that. The hospital does not comprise of nurses, doctors, pharmacists. The chief secretary into what any. So we have we did have a football tournament this year, February, in Ngozi Stadium, which the governor was very supportive. So that made us socialize. And again, it was a weekday that we had our time off duty but on duty.
Yeah, off duty
but on duty, because we were not in our offices, but we were on the ground, but officially on duty. Okay. So it's a moment that also binds us together, makes us also less stressful, fun, know one another. The thing is connection.
That's very nice. Connection.
Yes.
Because you really need to meet up with other
from all facilities.
All facilities.
Yeah,
my brother from Nyancha.
Yes.
Is it level 4?
Level 4. It's level 4. Yes.
Now they will about that tournament.
Mimi number 6.
Oh.
Just number 11.
And thank you so much. It was a pleasure having you. But you are one last parting shot, and
yes,
so combine it as your final statement.
My final statement, kwanza kwa kambi ya mwana seta ati viko torentaga.
Yes.
Kote wananchi gorea kambi ya tomorrow. And yente kana maroire yenda. Maroire yenda na ro mono specialize. Wananchi tika mamanya na gorea bonsi wenda tari alsa. Yenda tari alsa. Maroire na manga yenda almost 50. Igote kama chibapimo takorwale kuchialsa lioka no myaka ebere igotari alsa incho pimo na vera benegende kyao cancer na bego present na alsa na ukore mu rwasa meya pancreatitis na bego present na alsa igo tari kerendo kerenda ke kurwasa ina biko mono ego chanda abantu arafa marwe na ra kuruna marwe ya mabere paka gwate to tuge ngombe no nengo litego kuna atolie nyama tonyo mabere obuno bolimo ama mwana mabere paka mabere na rakoreta Brussels wasino bochafu onyama papokote oli wakokonka more direct bari konyara Brussels ono kwa magonya ntana bate marwira mabere igo lande no tuara mabere ngori itiro kunengo amatari bo kodi nyama tari bo otherwise even though they being tara kwana de abantu baje
I thank Keta TV for this opportunity. And I urge the whole community, the Kenyan community one, Azomo Gusi, medics with our colleagues. We are ready for you tomorrow. Mukaribie kesho mapema, muike mapema, tokonya ngora moba batoereru, turi ready go serve kero muntu. Biamondo.
Thank you very much. Mimi ni nani niongeze ama nitoe? But nitaongeza. Tell you I'm going to from where I sit from a media perspective and uyano bonge bororo. Rekenda robacha mba monyana ngasa hata usikose kesho. Njoo. Ugenda, njoo. Tell a friend to tell a friend, baganto by Tolimambia, again about the sense of having this thing next time around. Or whatever get, or the same want to see on so high naja. Ukikuja wengi, they will force them, but many medical camps, by Kinyamira County, but I go and beyond, Kinyamira their role, no corona. We have a very healthy society. No, free of diseases. And then I'm related to chest, malaria, skin diseases, on the rise. I also much because our time is up. Dr. Donald Ratemo, thank you very much. Daktari Oigara, thank you very much. Raymond. Yeah, thank you very much. Mawara Daktari Oimeke Marita, the CEO, KTRH, Omega Mange. Over department ya ENT, Nikadari Nyakundi, Omega Mange, Kolo Physiotherapy Ali Max Milan, Omega Mange, Ward 10, Roger Sumia, Omega Mange, Amange Sana, KTRH, Omega Mange. Pia Monasana, Esaba Konye, whatever you're doing is a good course.
Thank you very much.
What I'm ready to go to our time is up. But now what I've been in Chimbarigibono on my ground as a man you will go to Chenwaita, Tolan and Tokoyaman, because you can get TV, no ko Manyamanto, or Semia, Nakoba. At this point, you go to Alcobasemia, Nakoba Mania. The Tokona was one of an Bryson Makori, Wakanambiamono, Naya Morgeria, what to your feedbacks. We are very proud. Thank you so much. Just shout out for Sensory Transmission, Chingaki Franklin Mayunga, Arenge Asensemo Yechi Camera. When you buy a ministry of a channel, I get a breakfast show on Chibro Wazir, Sarah Ontita, whatever Natura Chingia, Miss Saudi.
Yeah.